Did they actually teach you that, or did you come up with that one?
That one I came up with on my own, but I have a little bit of ingenuity. But a lot of it is stuff that's just passed from rep to rep. You know, they talk about these things at sales meetings, and you know, then you pick up other people's sales techniques at these things.
So I really hope you're all listening, folks. I mean, this goes to show you how much your doctor actually cares about you, and the fact that your well-being is apparently not even entering into their minds. It's, you know, not only what kind of dinner are they going to go to, or possibly what kind of meeting are they going to be able to attend, but how much of their favorite pie are they going to get. I mean, that's quite an amazing reason to sell somebody out.
Well, it's just, you know, it was just a nice way to say, hey, listen, I want more of your business, you know, without actually doing that.
That is very good. I take my hat off to you, really. Boy, that really, well, it makes me feel like I was cheated, because I can tell you back in the days when I was a surgeon working at Kings County Hospital in Brooklyn, our big reward was the pharmaceutical reps would bring us in some Chinese food. You know, but the special aspect to that is we were allowed to eat those days, because we were so busy that if somebody didn't bring in food for us, you know, we would have to just go to the local candy machine and soda machine and just pick something up there, because the doors never stopped closing. But, boy, it's amazing that they're really getting wined and dined. And I guess that's one reason, Gwen, why so many of these white coats are just afraid to fight the status quo. And even though they know, they have to intuitively at least realize that nobody's getting better with this way of treating people, managing disease. They don't cure anything. Apparently, they're just as not wanting to leave this lifestyle that the pharmaceutical cartels are creating for them as the pharmaceutical reps who are basically, you know, leading the wolves to the goodies.
That's right. That's absolutely right. And, you know, I have to, one thing that I have to say in defense of doctors, Dr. Cartley, because I've worked with them so much, is that I don't believe that they're all bad people that really don't care about their patients. I think they have lost their direction. I think they have lost their noble purpose, because we revere doctors in this country as, you know, experts and as opinion leaders, people that we rely on and everything. And I've learned over the years that doctors are just people, just like us. I mean, they get up in the morning, they put on their pants, they brush their teeth, you know, and they make mistakes, and they have agendas. So it's individuals. You know, there's bad guys and there's good guys. I just think that the good guys sometimes are so confused because of so much disinformation and misinformation that they just don't know which way to turn. They don't know who to believe, you know.
I do agree with you, but I also know from being on the inside that many of them do know that there's something wrong. They may not know exactly what it is, but they certainly know that things aren't working. And they're filled with fear. They don't want to lose their license. They don't want to lose the Mercedes in their driveway. And so rather than be an advocate for those that have entrusted their lives to them, they allow the status quo to continue. And that is why I just honor you so much for stepping out of the box. We're almost out of time, but I just want to ask you in closing, how have the pharmaceutical companies responded to you, and have you had any problems?
Well, I obviously no longer have any friends or colleagues in the industry. Imagine that. But to be honest, I flew under the radar for quite a while, just trying to disseminate my information in the natural health care arenas and, you know, that sort of thing. And I really don't think that I was out there for people to pick up on me until I spoke to the FDA last Christmas. And when I spoke before the FDA last Christmas, I mean, I became very high profile, and I've had my website attacked on numerous occasions. I really haven't had any personal communication from any pharmaceutical companies whatsoever. What generally happens is when I'm on radio programs like this, or, you know, one of my articles comes out or something, I get attacked via email or something from reps. And it's always young, you know, naive reps, because if it's reps for any period of time, They're generally contacting me to congratulate me for speaking out.
Wait, like I said, we're almost out of time, but please do tell me, I wasn't aware of the FDA situation. What do you mean you went and spoke to them? Did you testify in front of Congress, or what did you do?
Oh, I've testified in front of Congress here in Texas on numerous occasions. I have not testified in front of Congress in Washington, but no, there was an FDA psychopharmacologics hearing, a public hearing, and they were very cool in just calling it just a couple of weeks before Christmas last year. And, they have to have an open public forum. Well, I went and spoke to them with 65 other people at the forum, but I billed myself as a survivor. They had no idea I was coming as an ex-pharmaceutical rep, so they allowed me time to speak. And then I came incognito and whammed them with what I really was, because I am a survivor. I didn't lie to anybody, but I didn't go that route. I told them my information from a pharmaceutical rep's perspective.
Well, I would have loved to have been a fly on the wall for that one, but we're out of time. I want to thank you so much. Gwen Olsen, author of Confessions of an RX Drug Pusher, God's Call to Loving Arms. I am so happy that we have started to spread our word together. I can just imagine how the powers that be are getting a little nervous. And if you could just close by giving your website again, please, on which the listeners can get your book.
Yes, that's GwenOlsen.com, GwenOlsen.com. And I thank everyone for listening, and I please ask that you share the information with at least one person tonight.
And God bless you, Gwen. I can't wait to meet you in person and give you a big hug. Thank you so much for being on the show. Okay. And
thank you very much,
folks. Okay.
You are listening to Truth Today Radio. Don't forget to join us on our Truth Today fan page on Facebook. All music performed by Envisions Instrumental. Composed by Chase Holmes of Baltimore, Maryland, who can be found on Facebook